Every day, thousands walk through the doors of a hospital seeking care, healing, and hope. Behind the scene, dedicated nurses and doctors work tirelessly, saving lives, managing emergencies, and maintaining order amidst the chaos. Sometimes, even with best efforts of healthcare workers, patients' condition get worsened due to certain factors, leading to longer hospital stay and delayed recovery. One such factor is hospital-acquired infections. Let's understand this in detail. Hospital-acquired infections, also known as nosocomial infections. When we go to the hospital, we expect to get better, but sometimes people can get sick while they are there because of germs that are already present inside the hospital. It generally occurs after 48 hours of hospital admissions. Why are we concerned? Because millions of patients are affected, which increase the treatment cost and declines the patient's trust. As per statistics, nearly 10% of patients in India acquire at least one hospital-acquired infection. Let's see the types of hospital-acquired infections. As we know, not all hospital-acquired infections are mild. Some can cause serious complications like pneumonia, blood infection, or sepsis, especially as people who are already weak are elderly. The main types of HAIs are catheter-associated urinary tract infection, central line-associated bloodstream infection, ventilator-associated pneumonia, and surgical site infections. Now, let's see how patients get hospital-acquired infections. Firstly, by poor hand hygiene, use of contaminated tools, by various invasive procedures done in hospitals, overcrowded wards, and misuse of antibiotics. When healthcare workers or visitors are not following proper hand hygiene before and after attending patients, even a healthy looking hand can carry dangerous bacteria or virus. Second, use of contaminated tools. Medical tools or instruments which are not properly cleaned or sterilized can cause hospital-acquired infections. Third, invasive procedures. When patients are subjected to invasive procedures like IV cannulation, putting artificial airway, placing catheters, puncturing the skin, all these increase the risk of HAIs. Overcrowded wards. Having too many visitors in hospital might seem harmless or even comforting, but in reality, it can increase the risk of hospital-acquired infection for everyone. Frequent coming and going of visitors other than the visiting hours increases the risk multifold. Lastly, misuse of antibiotics. Over-the-counter consumption will lead to multi-drug resistance and individual will become more prone to infections. How can we prevent hospital-acquired infections? By following some simple steps like meticulously following hand hygiene, keeping the environment and surrounding clean, keeping the infectious patient in isolation as and when required, use of personal protective equipment, religiously following visiting hours by the relatives, and by adequate monitoring and surveillance of hospital-acquired infections. So, let us learn the 5 moments of hand hygiene which is given by WHO for healthcare workers. They are: first, before touching a patient; second, before a clean or aseptic procedure; after fluid exposure; next, after touching a patient; and lastly, after touching patient's surroundings. Now, we are going to see the steps of hand washing given by WHO. Wet your hands using a clean and running water. Apply enough soap or hand wash lotion. Rub palms together. Right palm over left dorsum. Left palm right dorsum. Palm to palm. Back of fingers. Rotational rubbing of thumbs followed by wrist. Now rinse your hands under clean water. Dry thoroughly using a clean towel or a hand dryer. After hand hygiene, next preventive aspect is by following respiratory hygiene and cough etiquettes. COTI can be prevented in patients with indwelling catheters by following few steps like keeping the perineal area clean, fixing and emptying of urinary bag timely, removing the catheter as soon as possible. Bloodstream infections can be prevented by following aseptic techniques while doing invasive procedures and by keeping the catheter port clean and sterile always. Ventilator associated pneumonia can be prevented by following 2 hourly mouth care and oral suction, head and elevation, and giving sedation breaks. Prevention of surgical site infection starts prior to the surgery itself by maintaining personal hygiene like regular bathing, wearing clean clothes, and following post-operative instructions. Let's revise. Hospital-acquired infections can be transmitted to patients via other patients, visitors, hospital personnel, surgical procedures, air, water, food, or even the hospital environment itself. Infection prevention is not an option, it's a duty. And the good news is, we now know how to do it with simple, everyday steps we just saw in this video. Thank you.